Hello, everyone. This is Dr. Garrett Smith, the nutrition detective, and we have a very important topic we're going to go over today. Again, I'm Dr. Garrett Smith of my website where I do consults with people is nutritionrestored.com. I have a supplement website at drgarrettsmith.com, 2 R's, 2 T's in there. And then my mighty network is at nutrition-restored.mn.co. And that's where I have the vitamin A detox program to help you out of problems you might be experiencing with what we're going to talk about today. What we are going to talk about today is how eating animal livers causes up to death and disease via vitamin A toxicity. And this has been well known for a very long time. What we're going to do today, what the goals are, we are going to utterly and completely dispel the myth and outright lie that vitamin A toxicity is impossible from eating liver, as people out there are saying. We're going to show that both humans and animals get sick and even die from vitamin A toxicity from eating liver. We're going to show that vitamin A toxicity can absolutely happen from eating liver just one time. We're going to show that the liver is toxic to consume from pretty much any animal that you would get it from. And I'm going to have the case studies and other paper links for all the assertions in this presentation in the PowerPoint slides link that will be in the description below. So let's get to it. Some of the definitions, just wanted to go over a couple definitions before we get started. First, cirrhosis is scarring or fibrosis of the liver. It is liver disease. It's long-term liver disease. Desquamation, this comes up a lot in vitamin A toxicity discussions, which is the peeling off of your skin. Like when you get really badly sunburned and all your skin peels off. We have dysentery, which is severe diarrhea with the presence of blood and mucus in the feces. Coprophagia, which is eating feces. Echolalia, which is the meaningless repetition of another person's spoken words. Bullae, which is large rounded blisters. And aurantiasis cutis, which is also known as carotenoderma, which is a yellowing or orangish tint to the skin. So I wanted to go over those definitions because these are things that we're going to talk about that eating liver has caused. So I wanted to make sure we knew what those meant. So first, we're going to go over the animals that have been poisoned from eating liver. And people go, but animals, like, aren't they supposed to eat liver? They might eat it. Just because we do something doesn't mean it's good for us. Just because animals do something doesn't mean it's good for them. So the first paper we're going to go over has bear liver killing a study rat. This is from the paper, The Vitamin A Content and Toxicity of Bear and Seal Liver. Quote, it has long been known among Eskimos and Arctic travelers that the ingestion of polar bear liver by men and dogs causes severe illness. It has also been reported that the liver of a certain seal, Phoca barbata, is poisonous, although opinion on this point is less unanimous. The very high content of vitamin A in the liver suggested that it might give rise to hypervitaminosis A if eaten in more than small amounts. The ingestion of excessive amounts of bear liver by rats led in one instance to fatal hypervitaminosis A, end quote. Okay, we got one death. We'll have more, don't worry. Next, we have a case of beef liver causing vitamin A toxicity in a cat. From the paper, hypervitaminosis A induced hepatic fibrosis in a cat. If you remember from earlier, hepatic fibrosis is cirrhosis. Quote, clinical summary, we report the first case of hepatic stellate cell lipidosis and hepatic fibrosis in a domestic cat that had been fed a diet based on raw beef liver. The necropsy findings of chronic liver disease coupled with osteopathology supported the diagnosis of hypervitaminosis A. As in human hepatology, if there is dietary evidence to support increased intake of vitamin A, then hypervitaminosis A should be considered in the differential diagnosis of chronic liver disease in cats. End quote. And they say, as in human hepatology, as in human liver disease, okay? Next, we have pork liver causing vitamin A toxicity in a cat. From the paper, Hypervitaminosis A in the Cat, a case report and review of the literature. Quote, a case of hypervitaminosis A with secondary entrapment and compression of the left brachial plexus nerve roots is described. A 9-year-old male castrated domestic shorthair fed a homemade diet based on raw pork liver was submitted for examination for a left forelimb lameness that evolved to paralysis over a 2-month period. Clinical examination revealed a flaccid paralysis and atrophy of all left forelimb muscles. An ipsilateral Horner's syndrome was also noted. Radiological examination of the cervical and thoracic spine showed massive new bone formation at the ventral aspect of the 2nd cervical to 6th thoracic vertebra. The diagnosis of hypervitaminosis A was made based on the clinical and radiographic findings, as well as the determination of serum vitamin A concentration, which was 630 micrograms per deciliter, 3 times above the upper normal limit for this species. Despite the unfavorable initial prognosis, the cat progressively regained function of the affected limb approximately 6 months after the diet was changed to a commercial canned food, end quote. There's some important things in here, right? All of the cat's problems were from the vitamin A because they all went away when the diet was changed. Okay? 3 times higher vitamin A than normal for a cat. Oh, but vitamin A in liver can't possibly be toxic. That's what people out there are saying. 3 times higher than normal, folks. Oh, but isn't an all liver diet like the best diet you could give an animal? Especially a carnivore animal, with all these people out there doing their carnivore diets, and some of them are doing all muscle meat. That's all right. Some people are doing lots of liver, lots of eggs, lots of cream, stuff like that, which is all full of vitamin A, and they might be wondering why they don't feel so good. If it can get a cat toxic, it's going to make you toxic too. Okay? Moving on. We have a case of sheep liver causing vitamin A toxicity in kittens. I only have the title of the study on this one. Severe retardation of growth with retention and displacement of incisors in young cats fed a diet of raw sheep liver high in vitamin A. Okay. And the last one, another one on liver causing vitamin A toxicity in a cat. I don't know what type of liver it was. The paper is called Hypervitaminosis A in a Cat. Quote, a 10-year-old cat that was kept on a diet consisting largely of raw liver was evaluated because of lethargy, partial anorexia, and weight loss of several months' duration. The cat's head and neck were rigidly extended, and a hard mass was palpable in the ventral cervical region. Cervical and thoracic radiography revealed proliferative bony lesions of the cervical and thoracic vertebrae, as well as of the sternum and costal cartilages. Serum vitamin A concentration was 4 times normal. For reasons unrelated to hypervitaminosis A, euthanasia and necropsy were performed 6 months after the evaluation. The skull and the cervical and the first few thoracic vertebrae were rigidly fused, and the vertebral architecture was altered by deposition of new bone. The sternum and costal cartilages were similarly affected. The historical, physical, radiographic, laboratory, and post-mortem findings were consistent with the diagnosis of hypervitaminosis A. On the basis of findings in this cat, hypervitaminosis A should be suspected in any sick cat fed a diet consisting partly or completely of raw liver, end quote. You ever hear about anybody, you know, when they say you're bone on bone, getting bone spurs? It's vitamin A toxicity, folks. Your cartilage is turning into bone. That's what's happening. It's not that your discs are disappearing or your meniscus is disappearing or being worn away. It is that it is turning to bone from the bottom and top down. My joint space is shrinking. No, your bones grew, just like I talked about in that cat. Okay, now we're into humans. The oldest known suspected case of vitamin A toxicity is what we're going to go over now. Guess what would have caused vitamin A toxicity 1.5 million years ago? The paper is called The Paleopathology of the Liver. Quote, our oldest evidence relating to the liver to disease is indirect, a probable cause of hypervitaminosis A in an early human fossil owing to the ingestion of excessive amounts of animal liver. The skeleton of a Homo erectus recovered from a site in Kenya, East Africa, and dated to 1.5 million years BP, showed periosteal bone deposition involving the long bones and skull. Thin sections prepared from the fossilized bone revealed the periosteal new bone to be coarse woven with enlarged, randomly placed lacunae. The same gross and histologic pattern is seen in modern patients with chronic hypervitaminosis A, invariably owing to misguided self-medication. As fire had not been yet put to use, the soft liver would have been the only easily eaten part of animal kills. Carnivore liver contains toxic levels of vitamin A, and it may well have taken some period of time before early humans learned to avoid carnivore liver. So in those days before we had really good knives, maybe 1.5 million years ago, if you tore open into the gut area of a killed animal, if you don't know anything about, butchering animals, it's not easy work, even with good knives. So you imagine what they had 1.5 million years ago. If you get in there, cutting muscles out of fascia is not easy. But if the liver's right there and it's the softest thing and you can get to it first, that's what they ate first because it was the easiest to get to. That's why vultures have these like razor sharp beaks to dig into dead animals with. The liver is not magic in terms of food. The liver is simply the easiest thing to eat, and then we built these myths around it, these urban myths, urban legends about it being the best thing that everybody wanted first. It wasn't they wanted it first, it was the easiest to get. Okay? Now, on to polar bear liver. Most people have heard of this. Most people hear about, don't ever eat polar bear liver, it could kill you. And then they go, oh, but beef liver is a health food. Wait, when is it poisonous and when is it not? What animal is it poisonous from and what animal is it not poisonous from? What's the magic difference? The poison is in the dose, that's all. It's still a poison, okay? The paper is called Hypervitaminosis A in Fractures. Quote, the toxicity of certain foods that contain high amounts of vitamin A has been recognized for centuries. The 1597 diary of Garrett Smith, which he wrote while taking refuge in the winter in Nova Zembla during an attempt to reach Indonesia by the Northern Passage, states that he and his men became gravely ill after eating polar bear liver. They feared for their lives, but ultimately recovered. De Vere's diary also notes widespread and striking desquamation during recovery. Skin peeling. Widespread and striking skin peeling. Gosh, guess vitamin A comes out through the skin and causes a lot of damage on its way out. Know any people with skin diseases these days? Dry skin, peeling skin, psoriasis, eczema. It's not a lack of vitamin A, folks, it's excess. Okay, so now we're on to sled dog liver, eating sled dog liver. This is from the Wikipedia entry on Xavier Mertz because it was the best summary I can get. You can find this story all over the internet. So Xavier Mertz was a Swiss explorer, mountaineer, and skier from Basel. He took part in the Far Eastern Party, a 1912 to 1913 component of the Australasian Antarctic expedition, which claimed his life. Wonder what killed him. On 14th of December, the party were more than 311 miles, 501 kilometers from the Cape Denison hut. As Mertz skied ahead, singing songs from his student days, Ninnis, the largest sledge, and the strongest dog team were lost when they broke through the snow lid of a crevasse. Together with the death of their companion, Mawson and Mertz were now severely compromised. On the remaining sledge, they had just 10 days worth of food and no food for the dogs. They immediately turned back west, gradually using the 6 remaining dogs to supplement their food supply. They ate all parts of the animals, including their livers. A 1969 study by Sir John Cleland and R.V. Southcott of the University of Adelaide concluded that the symptoms Mawson described, hair, skin, and weight loss, depression, dysentery, and persistent skin infections, indicated that the men had suffered hypervitaminosis A, an excessive intake of vitamin A. Vitamin A is found in unusually high quantities in the livers of Greenland dogs, of which both Mertz and Mawson consumed large amounts. Indeed, as Mertz's condition deteriorated, Mawson may have given him more of the liver to eat, believing it to be more easily digested. End quote. First human death from eating liver that we have today. Okay. Then we go into fish liver, which is the most common vitamin A toxicity from liver that we'll find in the literature. So Arctic fish liver. We're going to talk about the Eskimo. First paper, Social and Transcultural Aspects of Psychiatry. Quote, pit block toe or Arctic hysteria appears in Eskimo societies. Seen mostly in Eskimo women, symptoms include screaming, uncontrolled wild behavior, depression, coprophagia, insensitivity to extreme cold, such as running around in the snow naked, and echolalia. It has been suggested that it may be linked to vitamin A toxicity, as the Eskimo diet provides rich sources of vitamin A, such as liver of Arctic fish. Next paper, pit block talk, TOQ, I don't know how to pronounce that. Hysteria and Inuit nutrition, possible implications of hypervitaminosis A. Quote, experimental and clinical studies of non-humans and humans reveal somatic and behavioral effects of hypervitaminosis A, which closely parallel many of the symptoms reported for Western patients diagnosed as hysterical, and Inuit sufferers of Piblock talk. Eskimo nutrition provides abundant sources of vitamin A and lays the probable basis in some individuals for hypervitaminosis A through ingestion of livers, kidneys, and fat of Arctic fish and mammals, where the vitamin is often stored in poisonous quantities. End quote. Next fish case from Grouper. Paper is called Acute Fish Liver Intoxication, report of 3 cases. Quote, we observed an episode of acute fish liver intoxication in which 3 men experienced dizziness, headache, blurred vision, nausea, vomiting, fever, and desquamation after ingesting the liver of the grouper fish Cephalopholus bonac. One of the patients had full-blown symptoms and presented with a high fever, headache, dizziness, generalized aching pain, and superficial vesicles and bullae of the skin. The treatment was mainly supportive. In the follow-up period, he subsequently developed hair loss and diffuse peeling of the skin on his palms and soles. Symptomatologically, the clinical pictures of these patients were comparable to acute hypervitaminosis A or retinoid intoxication. The average vitamin A content in the grouper is high enough to cause acute vitamin A intoxication. End quote. Next fish case. Quote, this is from the same paper. A 23-month-old Chinese girl presented to the emergency department with vomiting, irritability, sore eyes, and a red peeling rash on her face. She had consumed 4 pieces of fish liver the night before. Her grandfather, who also ate the fish liver, had similar symptoms. Last case from that same paper. An 11-year-old Chinese boy presented with a 2-day history of abdominal pain, vomiting, headache, a red peeling rash over his body, blistering on his fingers and tongue, and perioral tingling. He and his family had eaten fish livers 8 hours prior to the onset of symptoms. Now, another fish liver case from a fish called hapuka. Paper is called Acute Vitamin A Toxicity, a report of 3 pediatric cases. A 14-year-old Chinese boy presented with a 12-hour history of vomiting, severe headache, and sore red eyes after ingestion of 8 to 10 pieces of polyprion oxygenose hapuka fish liver. His mother and sibling also had similar symptoms after ingestion of the same fish livers. The 5th case of fish liver was from shark liver. Paper is called Ingestion of Shark Liver Associated with Pseudotumor Cerebri Due to Acute Hypervitaminosis A. Quote, a 25-year-old previously well housewife was transferred from a peripheral coastal hospital to our department with a history of persistent headache, vomiting, and diplopia, that's double vision, developing over a period of 1 week following ingestion of a meal of cooked shark liver. All the other family members, too, who had partaken of this meal developed those symptoms, thus necessitating admission to the local hospital, but had recovered with symptomatic treatment within a few days. The 6th fish liver case from reef fish. So we have Arctic fish all the way down to reef fish. The paper, Vitamin A Intoxication from Reef Liver Fish Consumption in Bermuda. Quote, we report 3 historical cases of severe vitamin A intoxication in anglers who had consumed reef fish liver caught in Bermuda. The subsequent analyses of 35 fish livers from 7 different fish species revealed that very high concentrations of vitamin A exist in tropical fish liver, even in non-carnivorous fish species. Large variations in concentrations were observed between specimens and between species. The angling population, and especially pregnant women, should be advised of this potential health threat. End quote. Done with fish. Now we get to go into chicken livers. The first chicken liver case. Paper is called Chronic Vitamin A Intoxication in Infants Fed Chicken Liver. Chronic vitamin A intoxication. Quote, twin female infants were fed 120 grams of chicken liver homogenate daily for 4 months. They developed irritability, vomiting, bulging anterior fontanelles. Computed tomograms of the brain revealed enlarged ventricles in both infants and dilated subarachnoid spaces in one. Plasma vitamin A concentrations were elevated, end quote. Homogenate means they were making chicken liver pate. Next case, chicken liver, another one. This is 2 kids from the same family in the same paper, but I'm going to read the second one first because the next one's even worse. So I wanted to start with the less bad one. The paper is called Severe Hypervitaminosis A in Siblings, Evidence of Variable Tolerance to Retinol Intake. And yes, this is true. What is poisonous to one person may not be poisonous to another person. So just because somebody else says, well, I eat beef liver all the time and I don't have any problems, doesn't mean that you're not going to have them. And it doesn't mean that they're not going to have them once they eat enough. So, quote, the younger brother of, well, wait, let me back up 1 second. Just listen to all of the symptoms. Think about what kids in this country are dealing with all the time. What are the health issues you hear about with kids as I go through this? Quote, the younger brother of patient 1 had recurrent exudative otitis beginning at 5 months of age, requiring myringotomies and intermediate antibiotic therapy. Otitis media, characterized by a profuse black exudate, recurred at age 2.5 years, accompanied by lymphadenopathy, leg pain, and nausea. Limp, vomiting, and fever ensued, and papilledema was noted. Diet included chicken liver spread 2 to 3 times a week, but did not differ from that of the parents or the healthy sister. Radiographs revealed splayed cranial sutures, but long bones were normal. A cranial CT scan revealed mild non-obstructive hydrocephalus. By age 3.5 years, hepatomegaly, splenomegaly, and ascites were present, as were nausea, vomiting, bone pain and tenderness, lethargy, and otorrhea. By age 3 and 4/12, that's the way they wrote it, alopecia, a shiny erythematous exfoliative rash, and pleural effusion developed. Kid's 3.5 years old. It's got liver disease. He's got a swollen liver, swollen spleen, edema in his belly, in his organs, nausea, vomiting, bone pain, lethargy, otorrhea. The otitis media, that's ear infections. He was bald, that's alopecia, red skin that was peeling. They poisoned this child. But wait, it gets better or worse. You know, it's worse. It gets worse. His brother. The third case of chicken liver, resulting in death. But it's a health food. This is from the same paper. Quote, a 2-year-old boy had signs and symptoms of chronic hypervitaminosis A. A course of increasing severity led to eventual death. A younger brother later had similar clinical features. Chicken liver spread containing up to 420 units per gram of vitamin A was the likely source of intoxication. His first 6 months of life were complicated by poor growth and persistent otitis media. Myringotomy tubes were placed and bilateral mastoidectomies were eventually performed. He was otherwise healthy until age 3 years when he complained of severe leg pain. Radiographs demonstrated periosteal newborn formation on both tibias, both femurs, and the right radius. Increased intracranial pressure and splayed cranial sutures and hypercalcemia were present. In the following year, otitis recurred and symptoms of increased intracranial pressure, headache, nausea, vomiting, and papilledema continued, necessitating placement of a ventriculoperitoneal shunt. An erythematous exfoliative rash, alopecia totalis, liver disease, and ascites ensued. He died of renal failure associated with severe coagulopathy, pneumonia, and sepsis. End quote. Chicken liver killed a 2-year-old. Okay. Well, a 3-year-old. He made it to 3. Health food, whatever. Now we're on to beef liver. Everybody's been waiting. Well, what? We haven't talked about beef liver yet, Dr. Smith. Here we go. The first case of beef liver leading to cirrhosis, liver disease, fibrosis or scarring of the liver. The paper is called Hepatic and Dermatologic Manifestations of Chronic Hypervitaminosis A in Adults. Report of 2 cases. Quote, hepatic cirrhosis developed as a manifestation of vitamin A toxicity in one of the patients. This appears to be the first reported case of chronic hypervitaminosis A in an adult induced by the long-term frequent ingestion of beef liver. What is long-term? Is it different for one person or different for another? What is frequent ingestion? Is that once a month? Is that once a week? Is that twice a week? How much is it? You don't know until you're poisoned. Enjoy your liver. Why do you think people don't like liver so much? Do you think there's an intuitive thing? Do you think people, kids especially, will not eat the stuff? Most adults won't touch the stuff. Do you think maybe there's a reason they don't want to eat it? Do you think their gut tells them this is bad for you? Now, this one people will be interested in. I talk a lot about vitamin A toxicity, and does this country have, I believe this country and much of the world has a vitamin A toxicity problem, especially the Western nation. America, do we have a problem with obesity? You'll find interesting correlations in this article. The paper is called Liver Lover's Headache, Pseudotumor Cerebri and Vitamin A Intoxication. Quote, we wish to draw attention to dietary habits of patients with pseudotumor cerebri a syndrome of elevated intracranial pressure that typically occurs in obese young women and is characterized by headache and papilledema. The nature of this condition is usually undiscovered, but is associated with a variety of disorders, the most predictable of which is vitamin A intoxication. Let me repeat that part. The nature of this condition is usually undiscovered, but is associated with a variety of disorders, the most predictable of which is vitamin A intoxication. In fact, pseudotumor cerebri occurs in 30% to 50% of patients with hypervitaminosis A. This causal relationship prompted us to conduct a dietary survey of approximately 50 patients with idiopathic pseudotumor cerebri. Surprisingly, we discovered 5 patients who ate beef liver at least once or twice a week. Continuing on, quote, several patients consumed liver at multiple meals during a single day or regularly on luncheon sandwiches. 2 patients disclosed that they routinely purchase 6 to 24 pounds of liver each week. None of the patients were using any of the medications occasionally associated with pseudotumor cerebri. Dietetic estimates of daily vitamin A intake in the 5 patients were 60,000 IU, 64,000 IU, 70,000 IU, 87,000 IU, and 341,000 IU. Recommended daily allowance is 4,000 to 5,000 IU per day. Random serum vitamin A levels, normally 30 to 70 micrograms per deciliter, were elevated in 4 of the 5 patients. 75 micrograms per deciliter, 107 micrograms per deciliter, 121 micrograms per deciliter, and 146 micrograms per deciliter. 2 patients were men and 3 were women. All 5 patients were mildly to severely obese, and each had habitually ingested liver for several years or more. These observations in adults warrant closer attention to the possibility of habitual ingestion of liver and other dietary sources of vitamin A in patients with pseudotumor cerebri. Added scrutiny of the diet is further justified because liver and vegetables rich in vitamin A are often recommended in weight-reducing diets, end quote. If you have headaches, it's quite possible that that's your sign of vitamin A toxicity, okay? Just so you know, the government in this country has lowered the daily recommendation of vitamin A down to 3,000 units. It's not 4,000 or 5,000 anymore, it's 3,000. The Teratology Society says that more than 3,000 units of vitamin A a day is what they recommend for pregnant women to avoid birth defects. And you may remember me talking earlier in this about gait, walking being a problem in the cat. And I did another presentation about Chris Masterjohn and vitamin A toxicity because he was mentioning he was having trouble with his gait. And you saw these numbers of daily intake, 60,000, 64,000, 70,000, 87,000, and 341,000. Somebody mentioned to me that Masterjohn had posted in another post that he was eating about 40,000 units of vitamin A a day. Still in the ballpark of causing vitamin A problems, especially when the one paper I have on osteoporosis showed that osteoporosis risk went up with 5,000 units or more a day in people, regardless of source. Didn't matter if it was supplements or foods or carotenoids. You know, people think that carotenoids are harmless. Nope, didn't matter. Okay. Another one on organ meats, which if we're talking about organ meats, I mean, what's the organ meat that most people eat the most? It's liver. Organ meats associated with worse sperm motility in men. So for those of you trying to get pregnant, men, I'm going to tell you, if something affects your sperm motility, it's affecting your testosterone too. So here's the paper. Meat intake in relation to semen quality and reproductive hormone levels among young men in Spain. Quote, The aim of this study was to assess the associations of intake of different types of meat with semen parameters and reproductive hormones in healthy young men. This cross-sectional study included 206 men 18 to 23 years from southern Spain. Men who consumed organ meats had significantly lower progressive sperm motility, 51.5% versus 42.8%, and higher luteinizing hormone levels, 4.0 versus 4.6 units per liter, compared with men who did not consume organ meats. Lower progressive sperm motility is not good, and higher LH, luteinizing hormone levels, is not good. Organ meats are they're the healthiest part of the animal. Keep thinking that if you don't want to, be fertile and don't want to have good hormones. Next, one of my favorite papers. It talks about how a high vitamin A vegetables plus liver plus seaweed equals vitamin A toxicity. Shocking. Seaweed is extremely high in vitamin A, if you did not know, carotenoids. The paper is called Vitamin A Toxicity Secondary to Excessive Intake of Yellow-Green Vegetables, Liver, and Laver, a type of seaweed. Quote, we report a case of sudden onset of vitamin A poisoning. A 20-year-old Japanese woman had been eating pumpkin and only a very limited amount of other foods on a daily basis for 2 years. She was overly concerned about weight reduction. Aurantiasis cutis, carotenoderma, and abnormal liver function tests were noted by her family doctor in 1995 when she was 18 years old. At that time, she stopped eating pumpkin. However, she secretly continued an excessive intake of other beta-carotene-rich vegetables, liver, and laver for about 2 years. 2.5 years after being seen by her family physician, she experienced sudden onset of low-grade fever, limb edema, cheilitis, cracks in the lips, dry skin, and headache. These symptoms worsened daily. A liver needle biopsy was performed, and it showed a normal portal tract along with fat-laden Ito cells in the space of Dis. A final diagnosis of vitamin A poisoning and hepatic injury secondary to an eating disorder was made. Her symptoms and serum beta-carotene levels returned to normal with successful adjustment of her diet. Her symptoms and serum beta-carotene levels returned to normal with successful adjustment of her diet. End quote. But you can't get toxic from plant foods, carotenoids. No. Can't get toxic from liver. But her problems went away when she stopped eating that stuff. Seriously, folks. There's no leg to stand on for the argument that food vitamin A is not toxic, whether it's carotenoids or liver or other organ meats. Now, what if a national government warned against consuming liver? That would be interesting, wouldn't it? Well, the Finland government has warned Finland's government has recommended against liver consumption in the past. From the paper, Health Risks Related to High Content of Vitamin A in Liver. Gosh, who got to them, right? Quote, the Finnish Board of Health has issued recommendations on diminished use of liver and foodstuffs containing liver in order to avoid overdosage of vitamin A and the health risks related thereto. Inter alia, which means among other things, pregnant women and children are advised wholly to refrain from the consumption of liver and liver products. End quote. Let me just repeat that with the among other things. Among other things, pregnant women and children are advised wholly to refrain from the consumption of liver and liver products. Now, let's go into the second part where the Finnish government warns against liver consumption. From the paper, intake of vitamin A from liver foods among Finnish 1, 3, and 6-year-old children, a quantitative risk assessment. Quote, This risk assessment showed that long-term liver consumption may expose children to retinoid intakes higher than what is considered safe. The amount of vitamin A obtained from liver-based retinoids seems to remain below the safe intake from a single portion. With long-term consumption of liver foods, however, there is a risk of exceeding upper tolerable intake levels. However, in long-term consumption, moderate portions of liver foods are still safe as long as they are not consumed too often. The safe portion size and eating frequency depend on the age group and type of liver food. When considering the total daily vitamin A intake from the nutritional point of view, liver consumption has a positive effect. However, the benefits of eating liver can probably be substituted by a well-balanced diet with plenty of vegetables and a reasonable amount of meat without the risk of an excessive intake of retinoids. You notice how that's the end quote. Notice how they're trying to say, well, you still need it. You can still eat it and it's still a good food, but you might get sick from it and you might get hurt from it. So don't get too much. But what is too much? Well, we don't know, just not too often. How many times can I take this poison before I get poisoned? Just enough times. How much poison can somebody take before they get poisoned? How much poison does it take? Just enough. Just enough. That's it. So, in conclusion, we should have completely and utterly dispelled the myth and the outright lie that vitamin A toxicity is impossible from eating liver. I'm going to suggest that you don't listen to anyone who suggests otherwise. And I would suggest you share this research with them. I've shown that both humans and animals can get sick and even die from vitamin A toxicity from eating liver. We have 1 rat and 2 human deaths. What other foods can you imagine on a daily basis that you can read about people dying from eating too much of them? Not from choking on it, but from just eating too much of a certain food. Be pretty hard pressed when you're not talking about like a poisonous fish in Japan or something like that. We've shown that vitamin A toxicity can absolutely happen from eating liver just 1 time. And that the liver is toxic to consume from any animal. When you hear people talking about the liver stores toxins and you can get sick from eating liver, what people don't realize that they're talking about is the liver does store a toxin. It's called vitamin A. And that's what makes people sick from eating liver. So I remember I was seeing an article from somebody saying, well, the liver doesn't really store toxins. It stores vitamin A, and this is well known. And I just showed you how toxic it was. Again, I've provided the case studies with links, and it'll be in the link below. So you can go look at these scientific references. Most of them are straight off of PubMed, or they're from actual journal, direct to journal links, or I have the PDFs linked even. So you can find what I'm saying to be true. Now, maybe you've eaten a lot of liver. Maybe you want to know how to fix your vitamin A toxicity, and maybe just going low vitamin A diet is not going as fast as you want, or it's not helping you as quickly as you'd like. Or maybe you're just still feeling not well. My website is nutritionrestored.com. That's where I do what's called nutritional restoration, working with people to restore their nutrient levels that are depleted by vitamin A. I also do homeopathic detox therapy to undo some of the damage from things that cause vitamin A toxicity, that are known in the literature to cause vitamin A toxicity, including things like antidepressants, birth control pills, Accutane, other vitamin A pharmaceuticals like Retin-A, things of that nature. My network, my own mighty network, which is where the vitamin A detox program is kept, is nutrition-restored.mn.co. Sorry, my normal website, nutritionrestored.com, no dash. My network, which is kind of like a little mini Facebook for people who are interested in my work to chit chat, nutrition-restored.mn.co. This will be on both YouTube and BitChute. My YouTube is youtube.com/nutritionrestored. My BitChute is bitchute.com/my-channel. I'm sorry, it's bitshoot.com/channel/nutrition restored. And that's how you can find me more. If you don't feel good when you eat liver, you now know why. If you have people trying to push you to eat liver and you hate it and you don't think it's good for you and you don't think it's a good idea, then send them this, because they need to know that this stuff is toxic and they need to stop recommending it to people. So anyway, I'm Dr. Garrett Smith, the Nutrition Detective. Hope you enjoyed the presentation. I will see you all in the next video.